According to the Mayo Clinic, depression is a treatable condition. Did you know that? Well, for some people, standard treatments, though, aren't effective. And by standard treatments, I mean psychotherapy or talk therapy or medication. For those people, they have a condition called treatment-resistant depression. Even though I think that term is misleading because it makes it sound like there's nothing you can do if you have that condition, when in fact there are many options. They're just not your typical antidepressants and therapy combination. So the options for treating treatment-resistant depression can range anywhere from lifestyle changes to ECT or electroconvulsive therapy, where you are put under general anesthesia and electricity is used to trigger a seizure in your brain. Pretty invasive, and I've read that there can be a lot of risks and side effects to that kind of operation. Now, I did something called transcranial magnetic stimulation therapy, which was wonderful because it was non-invasive and I didn't have to go through anesthesia. I think it was pretty effective for me. If you're wondering what does TMS feel like, or even does TMS hurt, I can answer that based on my experience. Disclaimer, I am not a medical professional or a licensed or certified anything, so please don't take my videos as advice. Just view it purely for entertainment purposes. However, I did get my information from the sources that I cited and listed in the description below. So transcranial magnetic stimulation therapy, or TMS for short, therapy is a treatment technique that uses a magnetic field to influence brain activity. It can treat depression, obsessive compulsive disorders, and other brain-related conditions. How could the magnetic fields influence your brain, you ask? Well, your brain is full of electricity. The brain cells in your brain and nerves, known as neurons, use tiny amounts of electricity to send information throughout your brain and body. The magnet used in TMS targets the areas in your brain related to your emotions, internal decision-making, feelings of pleasure, etc. During TMS, electromagnets are placed on the head and they send out targeted magnetic waves to stimulate and reset brain networks that regulate mood. How do doctors know that the magnet is helping and not hurting these areas of the brain? I don't think they truly know the details of how it works. They just know that it does work. According to this article on the National Library of Medicine titled "Use of Transcranial Magnetic Stimulation for Depression" that I cited below, quote, "Many randomized clinical trials have shown that daily TMS was effective in treating depressive mood symptoms with remission rates of 30 to 40% of cases." Personally, I tried different medications for over 10 years, and I was surprised when I learned the facts of the efficacy of medication versus TMS therapy, how much more effective TMS therapy is. Overall, I think TMS gave me the possibility of experiencing things like joy again. But without therapy, like talk therapy and emotional support throughout the TMS, I wouldn't have been able to break old patterns and ways of thinking and form healthy new ones. As far as what does TMS feel like, it feels and sounds like a woodpecker is chipping away at the side of your head. And with my earplugs on, which you are recommended to wear while you're doing this, the machine sounds just like the cartoon sound of a woodpecker, and it's beating into the tree, which is your head. And then there's a pause, and then it starts again for about 20 minutes. I think that's probably why some people experience side effects like headaches and tingling. The first day, I got a headache for sure, but it went away as the day progressed. However, the first day I also got very sleepy, and I remember I was very tired. Maybe that first week, actually, I was very sleepy as I was getting used to it. After the first week, I really didn't feel side effects at all. Again, this is just my experience, but maybe it just wasn't as horrible for me. If you're also wondering, does TMS hurt? For me, yes, it did. A little bit. It felt like a pinch inside my brain, but it was very fast, very small, it zapped my brain, but it wasn't anything unbearable. Towards the end, I got pretty used to it actually, and it didn't feel invasive it just didn't hurt a lot. That was just my experience. Honestly, I think a COVID test is more invasive. As far as positives for me, I did notice that after just a few weeks, I began feeling so much better. I reacted much calmer to stress, so I definitely felt just overall less overwhelmed because I just had been feeling like I couldn't even write an email, let alone go to work and do everything I needed to do in my life. So after just a few weeks, I was able to see the difference with me being able to get through tasks at work, at home, in my life so much better. So overall, way less overwhelmed. I think TMS therapy is an excellent option for those of us who have tried so many different medications and can't find something that truly works. Maybe your medication has terrible side effects that you can't stomach, or maybe your brain is just not reacting and recovering fast enough with medication. Remember that TMS therapy lasts only about 6 weeks and has been proven to work, or 36 sessions about. I mean, I know some medications that take at least 3 months to even start working and for you to start feeling the medication being effective. So my recommendation is, if your insurance covers it, try it. Now, lastly, if you're wondering about TMS cost with insurance versus without, check out the total amount I personally paid with insurance in my last video.